Hello, I'm Dr. Sundari Mace, Sonoma County's health officer. I'm here to share the latest updates on coronavirus with you for Sonoma County. As of today, May 22nd, there are 444 confirmed cases of COVID, up 11 in the last 24 hours. 233 are active, 207 have recovered, and we still have the 4 deaths that we've been reporting. We've now performed 18,773 coronavirus tests, up 1,350 in the last 24 hours. And we have a 3% positive rate. So as we head into the Memorial Day weekend that many regard as the beginning of summer, I wish for everybody to be safe. The parks are open, as are other activities, and please do go out and enjoy things with general guidance for the facial coverings and for all of our general mitigation measures. Sonoma County is gradually opening up because we're demonstrating success at meeting those benchmarks that we've been talking about that are attached to the governor's resilience roadmap. So these benchmarks involve the following 4 areas: testing, contact tracing, containment, which is also known as quarantine and isolation, and surge preparation. For our county to remain healthy and progress to the further opening of the community, we all need to be continuing to do our part and to prevent the spread of COVID-19. Aside from the safe practices that we've been discussing all along, such as social distancing of 6 feet from other people, face coverings, and hand hygiene, knowing your health status through the COVID-19 testing is key to preventing the spread. So we do want everyone to get tested. Testing is a critical step towards opening the county. It increases our understanding of what's happening with COVID-19 in the community. It will give us an idea of whether we're seeing community transmission. We know that upwards of 40% of people with COVID have no symptoms, but they're still contagious. That's why we are encouraging everyone to take advantage of the COVID-19 testing available in the county. So there are several ways that you can get a COVID test. You can get a test through OptumServe. OptumServe is run by the state of California and operates 2 sites. One is in Petaluma, the other in Santa Rosa. Anyone can get an appointment to be tested through these sites. You can schedule an appointment at their website, which is lhi.care/COVID testing, or you can call 1-888-634-1123 if you don't have internet access or if you speak a language other than English. Testing is, again, open to all residents at this time. The Department of Health Services has a drive-through site in Santa Rosa for our priority populations. That would be essential workers, high-risk people in the community, like those over age 65 and those with underlying medical conditions, those people with symptoms. And then we're also open still for healthcare workers and first responders, whether you have symptoms or not. You can contact by calling 707-565-4667 to make an appointment. So we're also in collaboration with community partners, the Department of Health Services is connecting pop-up testing sites in different locations in the smaller communities, mainly on weekends and evenings, to reach individuals who are unable to access other sites. These locations will be promoted in the community as they come up with instruction on how to schedule an appointment. You can always go to the SoCo Emergency website for further information on testing. So for today, our community question is, when will antibody testing be available? Let me answer your question by first describing that the difference between the antibody test and the swab test that we're doing that looks for the actual virus. The swabbing that we're doing at the testing sites that I just described tells us if you have COVID-19 virus and helps us make a diagnosis of COVID-19. The antibody test, however, is a blood test that requires a blood draw that looks for antibodies to the virus. And this test will be used by public health for surveillance to see how many members of our community or certain subpopulations, like our high-risk individuals in the community, got infected with COVID over the past 3 months. So it's really a measure of immunity and not of whether you have the virus currently or not. We expect to have this antibody testing up and running by the end of next week or early in the following week. And we will be performing this test on high-risk persons first. That would be the first responder community, that are peace officers and firefighters, and also for some subsets of our healthcare workers. And keep in mind that this antibody test is really for those surveillance purposes, and we'll let you know when we're planning to extend that in the community to look for the amount of infection in the community that maybe was undetected previously. So we don't know yet whether having these coronavirus antibodies will protect someone from getting infected again with the virus, or how long this protection, if it's in place, would last. So thank you. Great to talk to you today. Stay well, and we'll talk again next Monday.